In this video, we'll be reviewing acute extrapyramidal side effects of the antipsychotic medications. These are dystonia, akathesia, and parkinsonism like side effects. The antipsychotics are divided into two generations, the first generation and the second generation. The first generation is also called typical antipsychotics, and the second generation is called atypical antipsychotics. What you must remember here is it is the first generation of antipsychotics which are most likely associated with EPS, acute EPS syndromes, but the second generation are also not free of it, but it is closely associated with the first generation. Keep this fact in your mind. And one more information I would like to give you here is, look at these two drugs, clozapine, the arrow, I'm pointing the arrow at clozapine, and quetiapine. These two drugs have almost low to nil risk for EPS syndromes within the therapeutic range. Clozapine and quetiapine have almost low to no risk for EPS syndrome if they are used within the therapeutic range. So let's move. First, dystonia. It is, you must remember this as a prolonged contraction in a particular muscle. This muscle can be most likely involving your head and neck region, but it may also involve other parts of your body. So it is just an increased or prolonged contraction in a particular muscle which will lead to an abnormal posture. I've given two examples here. The first one is curling of toes. It will lead to the patient being unable to walk. The second example is painful turning of head towards one side if dystonia involves the neck muscles. One more thing you must remember is dystonia is extremely distressing to the patients. It is distressing and it may become one of the reasons for non-compliance of the drugs. Imagine what will happen if dystonia involves laryngeal muscles. Yes, it is fatal. It can be fatal. So it is the most dreaded complication if it gets to involve the laryngeal muscles. You must look out for dystonia immediately within few days or immediately few hours to days when you started and somebody on antipsychotic medication, especially injectable or parenteral route. Let's move on to before moving on to the next side effects, let's see some risk factor for acute dystonia. As I was telling you, high potency neuroleptic agents like haloperidol or flufenazine especially show if they are given parenterally or in high doses IV, like that. So you have such patients, or if you're using these drugs in such a manner, then you must look out for dystonia. Another risk factor is young age and male gender. Obviously, the history of prior dystonia increases the risk. Let's move. Akathesia, as I told you earlier. Now, this is a second side effect which we are looking at. It is a desire to be in constant motion, resulting in inability to sit. There is a compulsion in the patient's mind to constantly move, and even the examiner can make a note of that. It is not only a subjective feeling, it can also be noted objectively by the examiner. What happens is a patient usually experience an inner desire or inner anxiety or irritation, discomfort, which gives him the urge to move various parts of the bodies, and this is also very distressing to the patient, and it is one of the reasons for non-compliance or poor drug compliance. Lastly, parkinsonism like side effects. Uh, the symptoms of these side effects mimic just idiopathic Parkinsonism that can be rigidity, tremor, akinesia, or bradykinesia. You must remember the risk factor for Parkinsonism like side effects are the old age of the patient and history of Parkinsonisms previously. Old age, I mean to say greater than 60 years, and previous damage or an underlying damage to the basal ganglia. So this is Parkinsonism like side effects, but you must remember the two side effects here. I'll show the arrow, the akinesia and bradykinesia. These patients will present like they will have slow movements, they will have apathy, So you have to differentiate these two symptoms, that is akinesia and bradykinesia, from the negative symptoms of schizophrenia. That is important. You must differentiate these things from the negative symptoms of schizophrenia or depression. So this was the review of three acute APS of antipsychotic medications. I'll be talking about the treatment part in the next video upload. For more of such videos, please subscribe to our channel.